Kavanagh for Dubai Life TV. I'm here at the American Hospital today with ear, nose and throat surgeon, Dr. Muaaz Tarabichi. Dr. Tarabichi, it's very nice to meet you.
Nice to meet you.
So I've read that more than 50% of all physician visits are ENT related issues. What's the most common issue that you encounter?
ENT, of course, deals with ear, nose and throat, and it's a source of complaints for many patients. You get a sore throat, you get a nose blockage, ear pain and infections.
Do you deal with many patients that have hearing disorders here in the UAE?
Basically two kinds of hearing disorders. There is the run-of-the-mill stuff, which is usually related to infections and middle ear, what's called middle ear effusion, which is fluid behind the eardrum, happens a lot in kids. The more serious stuff, which is the nerve damage, hearing loss, patients born deaf. The overall international figures is 1 in 500. Here in the UAE, it ends up being a bit higher. It's about 2 or 3 out of 500.
Tell me about the technological advances in your field.
It falls back to treatment of these two basic conditions. The first one is when you talk about infections and fluids inside the ear. And in this area, I would say the biggest development is the ability to see inside the ear with the endoscope. So now we have a lot more access. We could treat the conditions a lot more effectively. The other part is, again, people born with who are deaf. And here the situation now changed dramatically with cochlear implantations. It used to be one of the most distressing piece of news that you would ever tell a parent. But nowadays, really, if you get to the child early, the deaf child, if you get to him early and you implant him with cochlear implants, you could predict almost a normal life and normal communication.
What is a cochlear implant and what exactly does it do?
The ear changes sound into electrical signals and sends these electrical signals to the brain. So these cells, called the hair cells, that picks up the sound and actually transform it into electricity and sends it to the brain, in the deaf population don't work. What the cochlear implant does is that it really takes the function of these cells. It picks up the sound from the environment and it codes it to electricity, and it sends this electricity onto the nerve that sends it over to the brain.
Can you give examples of some of the surgeries that you carry out?
I do really two types of procedures. One is what I just mentioned, the cochlear implantation, and the other one is what we call functional sinus surgery. We go inside the nose and we open up the tubes connecting the sinuses to the nose.
And what will usually be the ailment with the patient who needs sinus surgery?
In terms of symptoms, probably the most telling symptom in regard to the existence of sinus condition is the loss of smell. Besides the nasal obstruction, the fact that you can't breathe through your nose, recurrent infections, recurrent colds, mucus secretions in the nose, and of course sinus problems, or again being allergic problem, a lot of times they're associated with lower airway stuff, so asthma. So most patients who have asthma end up having sinus disease as well.
Okay, is that common here in UAE?
Actually very common. Here in Dubai and in the desert area specifically, you do have a specific type of allergic conditions related to fungus called allergic fungal sinusitis.
I personally suffer a lot from allergies. What advice could you give me to safeguard myself against them?
The most effective treatment for allergy, when I'm talking about allergy now, I'm talking about nasal allergy, is nasal steroids. These sprays that you could use them for a long period of time. They're very safe and they're very, very effective.
Finally then, any general advice that you think it's wise to give to the people of Dubai?
One of the issues that provokes a lot of anxieties about people living in Dubai is the issue of air conditioning. And I think it's overblown. So I tell patients, relax about air conditioning.
So we're safe.
We're safe.
Okay, Dr. Tarabichi, it's been a pleasure to meet you.
You're welcome.
Thank you for talking to me today.
Thank you.